Hello, my name is Alison Large and I'm one of the Dental Legal Advisors here at the DDU. This is my second presentation in our series covering the topic of working remotely. In this video, I plan to address some frequently asked questions we have received on our advice line relating to remote consultations with patients. I plan to discuss some of the record-keeping aspects of working remotely and provide some advice on remote prescribing. Firstly, I would suggest that both you and the patient are in the right environment to hold a confidential conversation. If you're working from home, give consideration to how you may best prevent interruptions from other household members, including children or pets. Make sure that you have the equipment you need to support the consultation. For example, you may wish to ensure you have a good telephone signal and working technology. This is particularly important if you intend to receive photographs or if the consultation is going to be conducted using a video link. 2. Be prepared. Whether working from home or conducting remote consultations from the practice premises, if you can have access to the patient's existing dental records, these may be immensely beneficial to you. Often, a patient's existing dental record may contain helpful information about the patient, including their previous medical history and dental history. Many practices have been able to securely share patients' records with people who are working from home. However, the records might not be available to you at the time you're conducting the consultation with the patient. This could be because the practice has not been able to make the arrangements for this, or because the patient does not usually attend the practice. It is possible that you might be expected to triage patients who are effectively entirely new to the practice. As you usually would do for any new patient, it's important that you obtain and record all necessary information about the patient. This would include a full medical history, dental history, and assessment of their presenting condition. Accurately gathering this information will be essential to enable you to issue advice that is appropriate and safe for that patient. 3. Ensure that you're able to identify the individual who is seeking the advice and ensure that you are speaking to the correct person. This may be particularly relevant if the patient is a child or does not have capacity. Do bear in mind the normal considerations regarding confidentiality and consent still apply. 4. Introduce yourself formally. Explaining your role and the purpose of the consultation are important. This may be particularly relevant if you're speaking to someone that you have not seen previously as a patient. 5. Undertake an appropriate COVID-19 risk assessment. It's important to establish if the patient is a possible or confirmed COVID-19 case. You will need to assess any COVID-19 isolation, shielding, or risk factors so that you can offer appropriate advice for the patient. 6. Conduct your assessment of the patient's presenting condition and document appropriately. We've been asked on a number of occasions about the necessity to obtain a full signed written medical history from patients seeking advice. It may be that there are arrangements at your place of work that enable a medical history document to be completed and sent electronically to you in advance of the consultation. Such arrangements may be helpful to have in place, but are not essential. If you are taking a verbal medical history, we advise that you make a note of all the questions asked, together with both negative and positive responses given by the patient. As with a face-to-face consultation, it might be necessary to clarify any areas that may be ambiguous or a cause for concern. To ensure you're in a position to advise or prescribe appropriately, there may be occasions where, with the consent of the patient, you consider if it's first necessary to liaise with their general medical practitioner. Any discussions that you have with their doctor should be noted in the records. When assessing a patient's clinical needs and providing advice, it's sensible that you're able to justify your rationale for your proposed approach. Examples of clinical guidance which can assist with triaging decisions in the COVID-19 pandemic include guidance produced by the Scottish Dental Clinical Effectiveness Programme, the British Orthodontic Society, the British Endodontic Society, and the Faculty of General Dental Practice. I have included these links on the webpage. Any notes that are made during a remote consultation which have not been directly entered into the patient's usual record should be added as soon as it's practical to do so. This will ensure that the patient's record is complete. The date and time that they have been added to the patient's usual record should be recorded. The actual note of the remote consultation should also record the date and time they were made, as this will make it clear when you consulted with the patient and when the record was transferred. 7. Steps to take if receiving images or video footage as part of a remote consultation. Undertaking a remote consultation can be greatly assisted by the use of pictures or video footage to help with the diagnostic process. The NHS-X website provides some practical guidance on utilising technology to send, receive and store images. And again, this link is included on the website. If a consultation is recorded or if a picture is sent by the patient, these will need to be added to the patient's clinical records. It would be appropriate to inform the patient that this is the case and ensure that you've obtained the patient's consent for the recording or images to be retained in this way. It can be sensible to explain to the patient the reasons for wishing to store the information, how it will be stored, and the length of time it will be retained for. As with any notes made of the consultation, this information should be transferred to the patient's main dental record as soon as it's practical to do so. If the video call is not recorded, a note should be made of the discussion that took place and your observations of the consultation, just as you would do with a face-to-face consultation. Further guidance on information relating to this topic is available on the DDU's webpage, and again, I have included a link to this. 8. Remote prescribing. When considering the need to issue a patient with a prescription for analgesics or antimicrobials, it is important to ensure that you are prescribing in accordance with current guidelines. The Commission on Human Medicine has produced guidance on the use of ibuprofen and coronavirus. The FGDP have written an open letter about the clinical standards that remain applicable when prescribing antibiotics. To comply with the guidance on social distancing and limiting travel, it's sensible to take steps to ensure patients and staff do not need to have any unnecessary face-to-face contact. We've had a number of questions with regards to this, and I'd like to reassure you that the Human Medicines Regulations 2012 makes provision for dentists to contact pharmacies to allow the issue of a remote prescription. In the current coronavirus pandemic, arrangements can be put in place so that pharmacists can receive the necessary information. For example, a copy of the prescription by email to allow them to dispense a dental prescription. The pharmacy must receive a hard copy of the prescription signed by the prescribing dentist within 72 hours. Communication. When closing your consultation, make sure the patient understands the advice that you have provided. Satisfy yourself that you've effectively communicated any anticipated next steps, for example, any follow-up calls you intend to make to the patient. The patient may need to collect a prescription, or if there are further arrangements to enable the patient to be seen face-to-face, ensure you have been clear about what the patient needs to do next. Try to manage the patient's expectations as far as you can regarding these next steps and any associated timeframes. I hope that you have found both of the videos that I have done on remote working helpful. As a mutual organisation, we are here for our members and to support all of you with the challenges we are aware that you're facing during the pandemic. As an organisation, we wish to ensure that we're providing you with the guidance and assistance to support you in all sorts of new ways of working. I would also like to take the opportunity to invite you to email in other topics that you think it might be helpful for us to cover in this series of presentations. Email them to feedback@theddu.com with the subject coronavirus questions, and then we will try and incorporate them into one of our future presentations. Alternatively, if you're seeking any specific advice, please do not hesitate to call the DDU's advice line. The telephone number is 0800 374 626. The advice line is fully operational between 8 AM and 6 PM Monday to Friday, and we'd be more than happy to take your call. For urgent inquiries outside these times, including over bank holidays, we additionally provide a 24-hour service. At this very challenging and truly unprecedented time for the profession, I would like to reassure all of our members of the DDU's ongoing support and assistance.